Good, other side. So what you really have to do is squeeze your glute, squeeze your shoulder blade. Good, come on back. So she's using her upper abs here to pull herself up. From here, she's just going to lift her hips straight up and bridge off her knees. This arm's going to be here, just by your side. Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. We're here with Jessie. We showed you guys what the adjustments look like. We showed you guys what the manual therapy looks like. Now we're going to tie it all together and we're going to do some rehabilitation. So one of the things that I like to start with patients that are in lower back pain or people that are out of lower back pain but want to stay that way is we use what's called the McGill Big Three. So these are exercises that were coined by Dr. Stuart McGill. The first one is going to be the McGill Curl Up. So these are ones that you guys can do at home if you're somebody that has a history of lower back pain or you just want to do some things preventatively to prevent lower back pain. These are excellent, safe exercises for your back. So what I'm going to have Jessie do here, she's already set up in position, so one leg's going to be bent and one's going to be straight. What that's going to do is it's going to lock out her pelvis, so it's going to prevent any rotation down by the lower back. And then all I'm going to have Jessie do is she's going to lift her chest just up off the table, hold, and come down. And again, up and hold, and come down. I'll have you do one more, up, and come down. So Jessie did a great job. She's a pro at this. A lot of times people will maybe poke their chin out or something like that. So you want to keep your chin tucked, and this is a much better alternative to your typical crunches and sit-ups, especially if you're someone that's prone to lower back pain. The McGill curl-up's a great alternative. So now we're going to have Jessie do a couple on the other side. So whenever you do this, you want to break your set into two. So you want to do half of the reps with one leg bent and half the reps with the other leg bent. So again, I'm going to have Jessie come up. Good. She's going to hold for a second right there and come down. So she's using her upper abs here to pull herself up. She's holding and coming down. Notice there's no flexing or bending or twisting of the lower back. We're just working the anterior abdominal muscles as she comes up and down. Let's do two more. All the way up, 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 and down. So she's lifting her shoulder blades off the table, coming up, and down. Okay, guys? So that's the first of the McGill Big Three. That's the McGill Curl Up. Again, a much safer alternative to typical crunches and sit-ups and those things where you might be bending your lower back and putting some more pressure on there. This way you can work your abs without the stress on your low back. So the next exercise we're going to do is the bird dog. So I'm going to have Jessie get on all fours. This is a really good stability exercise to kind of work all around the muscles of your back, your sides, and the front. So the first thing that we're going to do with this exercise is we're going to make sure that we have a nice flat surface here, okay? So we don't want her sagging down too low, so show what that would look like. And then we don't want her rounding too much up like that. So we want her in like a nice neutral position. I always tell patients like I should be able to put a cup of coffee on your low back and without spilling it. And that's going to apply as well for when she goes through the movement that you guys will see. We don't want the lower back to move at all during this exercise. So what Jessie's going to do is she's going to extend her right arm and her left leg at the same time. Go ahead. She's going to hold right there, so she's working balance and stability. Good, come on back. And then same thing on the right side, so left arm, right leg. Hold. Come on back. Jessie's a pro at this, so it's not always going to be this easy the first time. Good, other side. So what you really have to do is squeeze your glute, squeeze your shoulder blade. Good, come on back. Again on the other side. Good. I'm going to have you hang tight for 1 second, Jessie. So another thing that I'll do with people sometimes is I'll grab a yoga block and I'll put the yoga block right on the low back. So now she has to go through the exercise without knocking the yoga block off. So no pressure, Jessie. Good. And other side. Perfect. If you want to make it even more challenging, you decrease the surface area and put the yoga block vertically. Perfect. Keep the glute tight, squeeze, and back. Rest. Good. So as you can see, Jessie did a great job there. The reason that the yoga block is on the back is to make sure that she's not twisting or bending or else we would lose the yoga block. So she was able to maintain a good position with the block this way. This way you can start it here, but the lower surface area that you have, the more challenging it's going to be. The third of the McGill Big Three, I'm going to have Jessie lying on her left side, please, facing the camera. And a lot of you might know this as a side bridge, but we're actually going to go off of the knees, so bring your elbow in a little bit. And what I'm going to have her do is, from here, she's just going to lift her hips straight up and bridge off her knees. This arm's going to be here, just by your side. Yep. And this one we're just going to hold. So for now, I'm just going to have Jessie hold for about 15 seconds. What you want to think about during this exercise is keeping your hips up off the table, so kind of squeezing your side and your glute. And then you want to create that pressure around the abdomen to protect that lower back. So again, we're trying to just be a statue here. So no bending, twisting, rocking. And you can hold this position from anywhere from 15 seconds to a minute. Go ahead and come down, Jessie. So again, guys, you can go ahead and sit up for me. Thank you. So again, guys, typically in a session here in the office, we might run through 1 or 2 sets of each. And then if you're someone doing it at home, you can do 3, 4 sets of each exercise. What I tell people is I don't put like a hard rep number on it, but I'll say go to technical failure. So do reps until you start to, again, if the yoga block falls off or if you start to feel your technique go. When you do these rehab exercises, you want to push yourself to the point that the technique falls apart and then cut it off there. There's no use in trying to hold an extra 15 seconds if your hips are dropping and everything like that. So again, we have the McGill curl up, we have the bird dog, and we have the side bridge off the knees. So give those a try, guys. Let me know what you think. Send us a DM or a comment if you have any questions. Thanks.